I'm sorry I'm not there in person with you all today. Obviously, living here in northern Queensland, I've got young kids, and life is complex. So I think through the wonders of things like Zoom, it's a great way to still take part and share, as I'll talk about a little bit in this presentation today. So the remit I've been given to talk with you all about and perhaps put forward my ruminations and thoughts on is about how to conduct high impact research. And I thought, whilst this is fundamental and I think common to all geographies, there is some of a regional bent that I'll put on this in some parts throughout as I go through. So a little bit about, how does someone like me get to where I've gotten? And it's just an absolutely fun story of how you get where you get. I've lived in Queensland my entire life, rather bizarrely. So born in Queensland, lived and worked in Queensland, and yet, as you can hear, I pronounce vowels, which seems a little odd. I actually grew up on a mango farm in northern Queensland, but I absolutely hate mangoes. I went to high school in Brisbane, but went to medical school here in northern Queensland and the second cohort at JCU, have done a master's at USyd, did my PhD at UQ, worked for a very long time at Metro North. I'm an adult renal physician trained through the College of Physicians with an associate fellowship in medical administration, and did, as was mentioned, a Churchill Fellowship overseas to bring new skills home. I thoroughly recommend to many of you to look at the Winston Churchill Fellowships as a potential opportunity. I'm really immersed in the space around nephrology and kidney genetics. I lead the National Kidney Genetics Initiative, co-lead the global kidney space around gene phenotype curation, ClinGen, based out of Boston, and have connection to a lot of different academic institutions around the country. And happen to just bizarrely, I'm here in Townsville, and so my home and my home base is here at the Townsville University Hospital. So I think it's a great, indication that where historically in Australia in particular, we've taken the bent as a highly, arguably one of the most urbanized countries in the world, that in fact, being outside of the inner center of the capital, you still can actually achieve a lot. And I think that that's really important, and geography really is no boundaries these days. Just to start off, to talk a little bit about, high impact research, it's really important to think about, well, what is the definition of success in this space? So as you'll get to see throughout my presentation, I absolutely love memes in terms of communicating complex topics, but I think that this is really the beginning of that story, because without a clear understanding of what success looks like, it's really hard to have a clear pathway forward. And so for yourselves, thinking on what does that success look like, as you think about that now, hopefully towards the end of the talk, as we answer questions and have discussion, it will have progressed a little bit in your mind. The research that we do, and I love putting this this historic postcard and first photo of the climbing of Mount Everest, because do we do the research that we do to make progress, or do we do the research that we do just to support what we already think we know? I think that's really important, because actually what we, that balance between, the old analogy of, a drunk versus a light bulb, do they use it for support or illumination, is a very, I think, apt analogy for the kind of research that we do, particularly in clinical spheres. With climbing Mount Everest, we're constantly achieving new things and doing new things. And well, where do you go when you've reached the top of whatever it was that you thought you were going to do? It's important to understand that, this is a never-ending kind of journey and moving forward. And the research that we do is really to establish the platform so the things that you or others may do next, I think, moving forward. The different domains of impact for research, and I think it's important to talk through this because it doesn't look like just one thing. There's different domains of how one could consider impact, and these are some borrowed from our NHMRC guidelines here and statements here in Australia around impact that can be defined in terms of health or health services and delivery, economic or health economic benefits, social and societal benefits, and of course fundamental knowledge. Even in this day and age, it's so important, I think, to value and recognize that knowledge in and of itself has intrinsic value. And as you'll see in a moment, I think translation is amazing and a major conduit we need to focus on, but in the absence of new knowledge and not having anything to translate, it's like having a car without any fuel. The conduit, as I just mentioned, for making meaning from the impact that we're generating in these kinds of domains is through implementation and thus translation. And I think this is important because it's the framing around this. And so when we're communicating to others the impacts that we are seeking or have generated, and it's important at both timescales within the clinical research or other research that we might do in terms of proposing it, or towards the end in terms of communicating outcomes, actually understanding that implementation translation, even if that's translation to the next program of research, is important. And this emerging concept, which it's important that we talk about and grasp onto, of being able to structure this in terms of case studies, so translation case studies or impact case studies, is actually really, really important. I don't think we talk about it enough because this is the kind of language that our funders are beginning to use, both philanthropic and what used to be considered category 1 funders, so national funders, but also our institutions. They're very interested in terms of what are the use case examples of the case studies of the kind of impact that we are generating through the research and clinical research that we're undertaking. Moving to personal impact, how do we conceptualize this? And I've been part of lots of in retrospect, interesting discussions, I would say, about how you define this. And there's somewhat, old school ways of looking at this in terms of publications, H-index, citations, grants, how many, total dollars, CIA grants, leadership of organizations and committees and things, presentations, invited presentations, arguably just like this, coming to present with you all, or at national conferences. And these are all, I think, part of the fabric of what one can communicate as being personal impact, but it's actually, I think, a much deeper thing than this, and there's a whole lot of other key components to personal impact to add. So specifically, personal impact really focuses on, I think, achievement, and these 4 core domains that I've, literally just sitting there reflecting over the last week or two. I've pulled from the domain; they don't come from anywhere, but and I may be wrong, or I may be partially right, or somewhere in the middle. But I think that understanding personal purpose, as I'll talk about a bit more, enablement of both oneself and others, of personal brand. And that's a really important concept because it's an external, I think, conceptualization of the things that we put forward into the world. So we have some control, but we don't have ultimate control of that. And also personal happiness, I think, is and fulfillment is a really important part of this as well, in terms of how you conceptualize achievement. So achievement is so much more than just, I think, the numbers on a page of how many publications and H-index and numbers of dollars and stuff like that. It's a whole lot of these other things as well in terms of personal and thus also research impact. For me, as I mentioned, I apologize, I love memes, but I think a really key thing, and I have always held true to, is if it doesn't, if it's not fun, I'm not doing it. And I think this Mary Kondo meme is just perfect, because if something doesn't spark joy, then why proceed? If it doesn't spark joy for you, then what's the likelihood it's going to spark joy for a substantial number of others? And there may be some, but probably not. And so I think a really key take home from myself is to enjoy what you're doing and find that there is a sense of fun in whatever it is you're choosing to do, and that should be a guiding light in perhaps those decisions that you're taking, career-wise, project-wise, research-wise, and other. So moving back to those 4, key, concepts that I kind of mentioned that I've been pondering, to be honest, and my hypothesis is around. So in terms of one sense of purpose, so this can be hard, and sitting and reflecting in terms of what's the thing or the group of things that you're wanting to do or you're trying to achieve that's over the horizon is really, I think, an important thing, but one should also not let it get in the way of beginning. So, I love this quote, and I'm using a whole lot of quotes today from other people, which I think, help to illustrate these points. But, this quote from Mark Twain, that the secret to getting ahead is actually just getting started. So the enemy of achievement is the pursuit of absolute perfection. I think it's so important to get going, and we learn by doing. It's highly unlikely, in fact, it's quite improbable, and would probably be quite unhealthy for, say, myself at age 18 to have woken up one day and said, my purpose is to be doing exactly what I'm doing now at the age of 39. I think that would have raised some eyebrows and probably some concerns around those around me. But I've defined what that purpose is and what I'm trying to achieve in my career, research-wise and clinically, in clinical research, through getting started and getting going. Brand is really important, and I don't think we talk about this, but I don't think we need to necessarily talk about it a lot. I think a really important concept here is that this is how people around us perceive the things that we do, and what is it that you stand for. I use this quote or a variation of it often with my trainees and with my students, that people generally suck. Not always, but people generally suck. And it's important to have that in mind, not with the expectation that that's the way it will always be, but rather the contrary, that we are personally seeking to say not be that. And putting forward, general concepts of what are the things that matter to you. Do you do what you say? Do you say what you do? Are you timely? What are your values? I think that's really important. Those are the things that really frame your brand. Are you an empathetic person, or are you someone who's, out, single-handedly for achievement? All of those things, there's no right and wrong here necessarily, but your values are so important to define this externally. And that also has a major impact on the opportunities that come, as I'll talk about that in a second. Another important thing about brand, and actually something personally to me, I have reflected on a lot over the last couple of years, that's incredibly important, is of doing no harm. And I don't mean this in a clinical context, say in the care of patients and families, but rather in terms of, personal attainment shouldn't necessarily come at the cost of others. So by proceeding or advancing with a publication or a grant or a program, that doesn't come at the detriment of somebody else in terms of direct detriment. It harms their opportunities or holds them back or things like that. And this can look like things like, I think as we often hear about it, non-inclusion of collaborators on publications, ghosting collaborators and not putting them on grants, things that, personally, I don't do. We all hear stories of it happening, but I think this has been a key thing conceptually in terms of defining my personal brand, and I think I would especially convey to yourselves. Enablement is a really broad concept, but I think it's key to research impact as well, because we aren't islands, and it's so important that we have that connection piece to people around us. So we all work hard. We all put in a lot of work because we're passionate about what we're doing. And all too frequently, I hear people convey or perceive that, getting ahead or being successful is just lucky. So, we're the lucky country, for instance, or person X is lucky because they got that grant or whatever. Rather, luck, I think, is best conveyed as instead actually being an equation of hard work meeting opportunity. The hard work part, we have control over. The opportunity, not necessarily much. And so by putting forward opportunity for others, I think is a really important part of that enablement of the community of practice around you in direct and indirect ways. Enablement's also about I think really importantly, about mentorship. So there have been multiple times in my career where mentors have been absolutely critical, and I've avidly sought them out and embraced having mentors and being a mentor. And I think that this is probably one of the most critical things of contemporary practice as a clinician researcher. We are very tough on ourselves, and even the most, I think, self-believing of clinician researchers will not necessarily see in themselves what others will, in terms of being able to see how far you can progress or helping them to achieve and advance. So I think, mentorship is a really fundamental tenet of personal advancement, of generating impact, because, impact is also partly a function of achievement, as I mentioned before, for each of us as clinician researchers. Happiness is important. I don't think we talk about this enough. I think we talk about well-being, which is a slightly, happiness adjacent concept. They're aligned and linked, but happiness is important, at least in terms of fulfillment of what you're doing. So do you enjoy what you're doing? Is it aligned to your value? Is it aligned to your purpose? And both within a research environment, so the things from a purely research perspective, but also life. So we are individually the collection of a whole lot of things, both in work and outside of work. And if those things aren't in alignment, well, that's unlikely to result in personal happiness and fulfillment. And so I think it is so important to do that. And a great case in point is one of the reasons I'm presenting to you today virtually through Zoom. I live in North Queensland. I have small children. On Saturday mornings, they have activities I've got to go to, which I really enjoy being part of. So I can't come to Brisbane today because part of my happiness is actually being here with my family and kids, and being part of doing that. So finding ways to mesh everything together and attaining this is, I think, a really important part of how we do what we do. And again, this links into impact because one is less likely to be able to, I think, generate, that kind of high impact that one can be proud of in the absence of this. So now moving through from the central hypothesis, as I've kind of mentioned, I completely, agree. Some of you may be asking that, or thinking I'm way off center with this, and that's okay because this is research. We're allowed to be off center from time to time. But how does achievement translate to success or a perception of success? And this is the non-linear piece, and which I think is really interesting. And as I think about this, some of the things I've already spoken on, I think, are the key linkers between achievement through purpose to success, like with passion, being passionate about what you do and about the things that you're planning to do. Mentorship as an enablement frame, I think, is critical. Brand, which is, as I mentioned before, is around values, and but also it's this concept of your modus operandi. How do you do what you do? What are your standard ways of doing and achieving what you want to do that are important to you? And then happiness through attainment or aspiration to balance. I recognise it's deeply hypocritical to some degree me talking about balance when all too frequently I'm up to ridiculous hours of the night doing research work. But at least the value of balance is probably a really important thing within this broader concept. So what do I do in this kind of space? Given, as I mentioned before, as a regionally based researcher who I would like to think is aiming to generate impact and has generated some, and I think my best case example or case study that I can communicate is how I've been substantially part of leading the establishment of a national network of 19 multidisciplinary kidney genetics clinics that have transformed the care of more than 1,500 Australian families with genetic kidney disease who previously had no access to diagnostic testing. And today, approximately half of them have been able to attain a precise diagnosis, which is transforming their and their family members' care. That's the kind of impact that I'm really happy about, and it brings me great contentment. To achieve that, I find great benefit in connecting locally. So I was previously in Brisbane for a very long time, on the campus I think you're actually meeting on today, there at Hurston. But I now reside here in North Queensland. I'm a kidney physician. Kidney disease is vastly more frequent, unfortunately, here in Northern Australia. So being proximate to those needs, I think has really been a boost and a charge to what I do in terms of that connection. I maintain connections statewide. I'm co-chair of the statewide research forum within Queensland Health. That's the committee of all the research directors of the HHSs in Queensland. It's nationally through Australian Genomics and the KidGen Consortium, as I mentioned, and internationally by presenting at meetings, going to meetings, having colleagues in collaborations, co-leading global initiatives. And each of these layers, local, statewide, national, and international, is critically important to the program of work and impact that I see myself as generating. What I do is team-based. I am not somebody who it's all focused on me at the very center. No, this is team-based. I have the great pleasure of working with great teams, and that's no accident. I've deliberately brought together and sought to build teams with very flat structures, and then having amazing collaborators who share both my passion and my values. That's really important. And continually having mentors. And mentors aren't necessarily, an individual mentor may not be a mentor for forever, but for a defined period. Having those mentors at different times for different functions is just so important. And then I get to do that as well. I mentor avidly. I get the pleasure and I get great personal enjoyment from mentoring students, both undergraduates or postgraduate students doing medicine when I was in Brisbane, but here now undergraduates doing medicine and other things in Townsville. Junior and emerging clinical staff, medical and non-medical, I think, which is important. Research higher degree students, I think not by design, but because of being so passionate about this, I mentor the largest number of people who happen to be pharmacy graduates. That wasn't something I necessarily set out to do, but it's amazing. They're all fantastic, amazing candidates, and I get so much enjoyment from them. As you can tell, I hope a little bit, I really enjoy what I do. And I'm not doing it if it isn't fun. I've said that so many times to people. I'm a fairly direct person, as you can probably tell, but I really need to be able to enjoy what I do. And that brings me energy and drive in being able to continue and do this, even at times, as we all experience, of some degree of adversity or challenge. I'm realistic and pragmatic. I'm always looking for and scanning for opportunities within my frame of values, and I hold myself accountable. I am practically militant with my diary and to-do lists, and have different programs that I use, both my diary as well as a program across all my devices, which has been transformative in being able to keep on top of things and how I do what I do. This is just me and what I do. It's not perfect. It's not necessarily directly translatable to everyone else, but I hope there are little bits of this that are somewhat usable for you in what you're trying to achieve in these next few years and your personal attainment of those kinds of impact stories. So beginning to sum up now, the overarching schema, as I mentioned at the beginning, of how to think about research impact, these different domains, and that value from that comes through translation and implementation, and the communication of research impact through case studies. That's the key thing. That analogy of if a tree falls in a forest and no one's there to hear it, did it really fall, is really important. If impact occurs and no one's able to effectively communicate it, does it really matter? It probably does, but the communication of impact is really the thing that adds the weight and value and oomph to it, I think mostly. The hypothesis I have that we, impact personally within a research environment is so much more than those black and white metrics that we put around ourselves in terms of personally defining success. I think I would put forward not as a perfect model, but as a model to liberate you somewhat from that doom scrolling kind of phenomena of looking at, oh, I've only got X number of publications or citations or grants or whatever, and feeling that you're somehow not worthy or not enough. Those numbers don't define you. They're part of your track record, but success is a very different concept. And thinking about these other dimensions in terms of your personal impact within your research impact, I think is a really important thing to do. And with that, I deliberately wanted to leave a couple of minutes for any questions, comments, outbursts, as I'm famous for saying, unfortunately here in my local team. And I look forward to hearing your thoughts, and please never hesitate to reach out if you have any questions or queries in the future. Only too happy to help.
Thank you, Andrew. That was excellent. Whilst we garner questions, I might just quickly ask one in the last 10 minutes. You mentioned multiple times about the value you ascribe to mentorship. I was actually curious as you were going from your graduation from your medical degree and moving into being towards your specialty in nephrology, was there a transition point between becoming primarily a mentee towards a mentor, and how did that essentially progress, and how did you recognize that?
It's a really good question, because I think in those earlier stages of our career, the time where we're most likely to benefit from it, it's something that happens more dare I say, haphazardly, and without as much clear direction and steering. I mean, I was fortunate in my early career. I worked for a couple of years in Mackay as a junior doctor, and I still remember that, the clinical mentorship from some of the physicians who trained me there. And then when I came to the Royal Brisbane, and they were the most amazing of people and really helped to solidify my values, both clinically, but in general, applicable across all domains. And then moving into nephrology training, I was very, very fortunate to have an amazing mentor who saw much more in me than I saw of myself, and was able to help me have the confidence to move into that part of my career, and then also importantly into a research part of my career. So, a quiet little secret is that, the first time I actually ever did any research was actually as a first-year renal advanced trainee. And to be honest, that's actually pretty late to be getting into doing any research. I get asked often by students here in Northern Queensland, that by not doing honours, are they fundamentally impeding their future research careers? And I've often, I think just after I arrived here in Townsville, when I was asked that question in a very serious way, I turned and said, well, I didn't do honours. I was offered to do honours, but I didn't do honours, and I didn't do research until I was a first-year advanced trainee, and I'm 37 and a full professor. I think I'm doing okay, and you will too. And they kind of laughed, but I recognize that mentorship is probably that key driver that enabled that. And as I've progressed, it's I've understood the value of it so much more, and I seek it out, and I don't feel embarrassed about asking for mentorship from people. I think that's the key thing, and I would encourage you all to not feel embarrassed or shy about asking for mentorship. It's a compliment to the people you're asking, and generally people are very happy to help others. I think it's a part of fundamental human nature.
Excellent, thank you. Do you have any questions from attendees? Just up the back here.
I was just wondering.
We've got a mic coming to you.
Hi, I was just wondering, you mentioned you were very strict about your to-do lists and diaries. If you had any software or website recommendation, I just was curious about what you use to do that.
So if you couldn't hear that, it's a question around the software you use for your to-do list or diaries.
Oh, yeah. That skillfully asked question, because I deliberately avoided mentioning it, right? My disclosure is I have no shares or anything to do with the company at all that makes this product, but I found it by accident, as a trainee. And if you use Apple products, it's a program called Things, literally capital THINGS. It's just one of many different, task tracking kind of platforms. I love it because it just works for me. I know other people it doesn't work for, and it works across all my different platforms and syncs automatically and lets me remind myself, in a week's time, I need to start working on X revision or X grant, and you can put things in or ideas and a date when you want to be it to come pop up onto your to-do list. So it's worked well for me. There is a paid program, so you have to pay, the 10, 20, whatever it is dollars to purchase it. There are other solutions too. So there are Microsoft solutions, I understand, in Teams. There's other platforms. There's also you've got a notebook and you write it down. Old school wise, I still occasionally go to doing that for different things. But Things as a program, and it's a German designed program, has been, for me personally, transformative. I can't talk to the experience of others, but give it a go if you're interested.
Excellent. Thank you, Andrew. We've got one more question there.
Hello. Oh, there we go. So you spoke a little bit about your team-based work and how you surround yourself with people like a fantastic team, and that facilitates a lot of your work. I'm just wondering, at what stage of your career did you start sort of moving into leadership roles in teams? And can you talk a little bit about the skills that are really important for sort of transitioning from being a part of a fantastic team to leading your own fantastic team?
That's a great question, because I think as clinicians, we have an intrinsic, head start or advantage because our job is around working with others and with people, and in a clinical environment, we work within teams. Practically is the standard now. I think from the very earliest part of, say, my research higher degree, that's something I began to do. And as I progressed more and towards the back end of my research higher degree, beginning to transition to, yes, leading most, but not all of the research I was doing or part of, and others leading other parts or working with others, and then transitioning to that early career leadership type stage. And I was really fortunate. Some mentors of mine really they put me forward to be, say, for instance, the national director of our National Kidney Genetics Consortium, which I can still remember when they said, oh, how about Andrew does that? And I was like, say what? Did you fall hit your head? I was really I didn't get that, but I think that has helped. And then working with people in teams, I have found intuitive because of that kind of background. And I think it's a key tenet, treating people how you want to be treated yourself. And I know we say that all the time. It sounds naff, but it's actually true. Looking after your teams is so enjoyable and helpful, and you get the best out of them. And I just, gravitate towards people who attain really high standards, and you find them or they find you sometimes at the most unexpected of moments and times. And when you connect to them, valuing them and holding on to them and looking after those colleagues and team members is really important. And I'm not saying that for other team members, you let them go, not at all, but for high performing team members, you hold on to them and look after them. And also if they find other opportunities to move on to other things. And I've had a program manager a couple of years ago who was just absolutely amazing, like all of them that I've worked with, and she had an opportunity that came up to go and lead I'm not joking, $500 million 10-year global research consortium. And I was just like, oh my gosh, that's the best compliment I can get as a team leader, that my staff member is that amazing that they're going to go off and do that, and you support and encourage them to go do it. At the end of the day, it shouldn't be that hard to make good and the right choices. And so that's what I constantly sought to do.
Excellent. Thank you for your time, Andrew. I think our Zoom meetings is about to cut off rather abruptly. So, but yes, thank you for your excellent talk, and hopefully good luck with your research as well.
All right, thank you so much all. Have a lovely weekend. Stay safe and talk soon.